Welcome to the Memorizing Pharmacology podcast. I'm Tony Guerra, the pharmacist and author of the Memorizing Pharmacology book series, bringing you mnemonics, cases, and advice for succeeding in pharmacology. Sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Let's get started with the show. Hey, welcome to the Memorizing Pharmacology podcast. I'm Tony Guerra. I'm going to go over 3 interactive activities from the Respiratory chapter, and we're going to do some filling in words, we're going to do some flipping flashcards, and then there's a case study at the end here. So we'll get started. Fill in the missing words. So blank, block antihistamine at the H1 receptor. Block antihistamine at the H1 receptor. That would be an antihistamine, is what blocks histamine at the, well, it would be plural if you're going to use block as a verb. So we'll check antihistamines. Yep, those block histamine at the H1 receptor. These types of respiratory medication may cause paradoxical effects, especially in children. And so paradoxical is actually meaning something like it's the opposite of what you expect to happen. So if you expect someone to go to sleep, they're wide awake. So we have the choices of antihistamines, antitussives, which are, well, we'll talk about what each are, anticholinergics, and xanthine derivatives. Okay, so let's first identify what each are. So an antihistamine, not to be confused with a decongestant, but antihistamines are like Benadryl and Claritin and Zyrtec, and then diphenhydramine for the generic name, loratadine, and so forth. Antitussives are those that stop cough or prevent cough. Anticholinergics, something like this would be something where we're going to treat, just like an albuterol inhaler, which is not an anticholinergic. Okay, it's a sympathomimetic that mimics the sympathetic nervous system. Okay, but something like ipratropium that is going to open up the lungs, but just using different neurotransmitter, I guess is the best way to say it. Affecting acetylcholine. And then xanthine derivatives, it's easier to just give the example of theophylline. Okay, but in this case, paradoxical effects usually come from antihistamines. If you've ever seen an unfortunate child bouncing off the walls basically in an airplane because the parents thought they would give them some Benadryl to make them a little drowsy, that actually often creates a hyperactivity in children, maybe 1 in 3 times. So let's check. Antihistamines do cause that paradoxical effect. Pseudoephedrine is a type of blank which acts directly on the adrenergic receptors and indirectly releases norepinephrine from its storage sites. So let's kind of break this down. The adrenergic, so ad means to and toward in Latin. Rene is kidney, so it just means something that is on top of the kidney, and that's our adrenal glands. So when we're talking about adrenergic receptors, we're talking about the adrenal glands and then norepinephrine as a neurotransmitter. So let's kind of put in our answers. Beta-2 agonist. This is going to be something like what? Okay, so a beta-2 agonist is going to be like albuterol, okay, opening up the bronchioles. Corticosteroids, so now we're talking about whether liquid or something like prednisone. That's going to be something that's going to help with inflammation. The antihistamine, again, we could use anything like loratadine, which is Claritin, levocetirizine, which is Xyzal, or diphenhydramine, which is Benadryl, and then decongestant. That would actually be the pseudoephedrine. So we think of maybe Sudafed, and when we go back to our mnemonics from Memorizing Pharmacology, if you look at the words here and you take away the P and the E and you take away the O, you actually see the word Sudafed in there. And they change the letters a little bit, but it's in there. So Sudafed is pseudoephedrine. Easiest way to kind of remember that one. But that's a decongestant. Okay. All right. Blank are medications which suppress a cough by depressing the cough center in the medulla oblongata or the cough receptors in the throat, trachea, or lungs, effectively elevating the threshold for coughing. So basically saying that you're not going to cough on just maybe you inhale some cold air. Okay, so it's going to take a little bit more to get that cough. So we have a couple that are a little bit tricky here. So an expectorant. Okay, so an expectorant would be something that would help kind of break up that mucus, and that's not exactly what they asked here, but that's something like guaifenesin, which would be the active ingredient in Robitussin, or Mucinex, something like that. And be careful. So that's just Tussin or just Mucinex. That is not Tussin DM or Mucinex DM. It's just guaifenesin. Antihistamines we've talked about, so diphenhydramine, loratadine, levocetirizine, or cetirizine, which is Zyrtec. Then antitussives. So this would be dextromethorphan. Okay, that's one of them, which would be the one that you can get over the counter, the DM and Robitussin DM, or the DM and Mucinex DM. But there are also antitussives that are codeine-based, and those codeine-based antitussives are behind the counter. Those need a prescription. And then anticholinergics mentioned, ipratropium, tiotropium. Those are two that would end in tropium, but those anticholinergics are really to open up the lungs. So antitussives would be it here. Okay, we'll check our work. Yes, that's correct. Okay, antitussive medication should be diluted with water to enhance effectiveness. Okay, so this is actually an interesting thing here when we talk about expectorants. When you talk about an expectorant, you're actually going to, they've actually shown that guaifenesin and water are pretty similar in their effectiveness. But antitussive medications, they don't have to be diluted with water to enhance effectiveness. So this would be false. We'll check our work here. Good, 1 out of 1 points. Okay, this episode is brought to you by the Memorizing Pharmacology series of books, where you can go to Audible and get your free copy. If you've never had a book from Audible before, just click on the link in the show notes, whether you're watching on YouTube or on your favorite podcast, and you can get your free audiobook to help you with pharmacology. So let's get back to our interactive activity. Fill in the missing words. What reduced the viscosity of tenacious secretions by irritating the gastric vagal receptors that stimulate the respiratory tract fluid, thus increasing the volume but decreasing the viscosity of respiratory tract secretions? So here we have our expectorants. I'm not sure if it needs to be capitalized because it's at the beginning of a sentence, so expectorants. Okay, and it looks like it has to be plural because they use the verb reduce. So again, this is what we're hoping something like guaifenesin would do. Okay, we'll check that. That's right. Okay. All right. Drag the words into the correct boxes. Okay, so this is a good kind of a review of how we should do this. So blank inhalers can be used as a short-term rescue inhaler. So we would think of an example like albuterol. Blank inhalers should decrease the frequency and severity of asthma attacks. So now we're going to think of something like Advair, which has fluticasone in it. Salmeterol as well. Okay, so we would put the beta-2 agonist here. That's the rescue inhaler like albuterol. We put the corticosteroid inhaler here. That would use to decrease the frequency and severity of asthma attacks. Anticholinergic medications are used for fast-acting relief of bronchoconstriction during an asthma exacerbation. Okay, so this would be false. Again, just because you will see, like in DuoNeb, you will see albuterol combined with something like ipratropium, but only the albuterol is the fast-acting relief of bronchoconstriction. The anticholinergic like ipratropium is not. And then the last one here, montelukast, it's kind of in the name where it blocks leukotrienes, and you see this leucast part of it. That's part of the ending from Memorizing Pharmacology, but blocks leukotriene receptors and decreases inflammation. And you would know this better as Singulair. And we'll check that, and that's right. Okay, so that was our first interactive activity with respiratory. Thanks for listening to the Memorizing Pharmacology podcast. You can find episodes, cheat sheets, and more at memorizingpharm.com. Again, you can sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet, or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Thanks again for listening.